Okay, good afternoon, Niles, and thanks for tuning in this afternoon for Niles Voice of Business. This live stream features interviews with local business owners, professionals, and village representatives to provide resources and insights for the businesses and residents of Niles. Today, Ben Cohen from Elevate Care here in Niles joins us. Welcome, Ben.
Hello, thank you for having me.
Thanks for being here. So let's start with a little bit about you, Ben. What do you do at Elevate Care, and how did you get to the location here in Niles?
Certainly. So I work for the Elevate corporate office, and my position is what's called a hospital liaison. And what we do, I'm technically part of the marketing department. And essentially, if you can imagine, we have a large network of nursing homes in Chicago and the northern suburbs, and we work very closely with all of our area hospitals. And that could take the form of somebody who is in the hospital who then needs skilled nursing care before they can go home. For example, they fell and broke their hip and they have stairs in their home, and so they can't go home for a few weeks until they're more able to walk. Or they have some sort of illness or infection where they need to get some sort of medication that can't be administered in a home setting. So that then they need to go to some sort of skilled nursing environment. So somebody in the hospital might need to go from there to a skilled nursing care facility, or vice versa. Somebody in the skilled nursing care facility, maybe they fell and hurt their foot, or maybe they got fever or some sort of sickness and they have to go to the hospital. So I am responsible for all of the communication between the hospital and the building, whether it's somebody in the hospital who needs to come to the building or somebody in the building who has gone to the hospital. So I'm responsible for handling all of that communication. And in many times, it's just a matter of physically taking the information, but also it could be a matter of speaking with the patient, speaking with the family. I mean, it's really tough. You don't realize I would say most families, you've never been in this position before. Your elderly mother or father is sick or hurt themselves. They're in the hospital. You know, yesterday you were just having lunch with them, and now today you're in a hospital and the doctor's telling you they can't go home or they need this or that. And it's really a stressful time. There's a lot of things that you need to do, paperwork and insurance and Medicare to figure out. So I find it certainly the most rewarding part of my job is being there to help these families. Having somebody who is experienced, does this every day, knows the ins and outs, and can really answer your questions and provide you the guidance that you're looking for while you're making this transition.
Excellent. So you told us my next question was going to be tell us a little bit about what Elevate Care does and what services you offer, but we kind of got there already, right? So it's skilled nursing.
So about that, absolutely, yeah. We're a class of care is called skilled nursing, and it's one step down from a hospital. And so if you think of a hospital as a place where there are doctors around 24 hours a day that can address all of your needs and monitor everything, a skilled nursing environment is one step down where there are nurses around 24 hours a day. And doctors might come see you, say, once a week to manage your medications or to see how you're doing. So we provide a whole host of different services. It could be anywhere from physical therapy needs, somebody, again, who had some sort of injury. We do dialysis services, so people who have kidney issues. We do respiratory services, somebody who might have lung issues or breathing issues, medication issues, a whole host of services, all the way down to simply somebody really just is not in a position to take care of themselves at home. They need help eating, they need help managing their social activities, they need help just getting around. And they might not have family members available that could take care of them at home. So we provide that, and that's a lower level of care, but certainly something that we do very frequently for many people.
Ben, is someone always coming from the hospital to you?
You mean versus from home?
Correct. Yeah.
So the bulk of admissions do come from the hospital. However, once in a while, people do come straight from home. The most frequent time when that would happen, though, would be somebody who was recently in the hospital and is now at home. And then they call up the hospital and say, hey, I just took dad home yesterday, but we're really having trouble. And then we might admit them straight from home. There is very not as common case where people are already working with some sort of home healthcare agency or some sort of community agency, and they are living at home with some additional help, and then the caretaker or agency might reach out to us, and then we would send an ambulance or a car to the house, have them picked up and brought in. So we do that once in a while, but I would say the bulk of our admissions come directly from the hospital.
Okay. So Elevate Care is new to Niles, just over a year, if I'm correct. And I hear tell that you were looking at a second facility in Niles. So what drew Elevate to Niles?
Certainly. So there was already this previous network of skilled nursing facilities that was called the Glens, and they have been around for decades. They had 2 locations on the north side of Chicago, and then several others spread out throughout the northern suburbs. Elevate Care is a newer company. We've been around for about 2.5 years, and the first thing that we did, in fact, was to take over that entire network. Which included Elevate Care Niles, which was formerly called Glen Bridge, located on Gulf Road near Gulf Mill Mall. And not to say that there were necessarily problems with the previous network. It was very well respected. However, like I said, it's been around quite a long time. So the first thing we did was a facelift. We began a $50 million renovation project network-wide. We built new physical therapy gyms, new rooms, new wallpapers, new hallways, really a revamp of the entire network. Now, unfortunately, we did have to pause because of the pandemic. Of course, we couldn't necessarily have construction workers coming in and out of the building in that regard. So we did have to pause, but for example, the location that we're talking about on Gulf Road just opened a brand new wing, just opened a brand new therapy gym. And, you know, if you look inside versus what it was a year or 2 ago, we really brought it into the 21st century, let's say. One example of an exciting thing that we've done at our Elevate Care Niles location is a system called Early Sense, which actually is a wonderful device. It goes underneath the mattress of somebody, any person. It goes underneath their mattress, and it continually monitors breathing, heart rate, things like that. And, you know, unobtrusively, it's just a pad that lies under the mattress, and it can alert our clinical team if there's any sort of change. So, for example, let's say somebody's having a heart attack, God forbid. It used to be you'd have to wait until a nurse came by and checked on you and took your blood pressure and your pulse and realized there was something wrong. But now we're getting that alert immediately to our system, and we are alerting the doctor, we're alerting the hospital, and we have saved, let me tell you, several lives since we introduced this. I mean, it's a really
Wow, that's amazing.
so just, I mean, just kind of some wonderful new innovations that we were able to bring to the table with our new fresh set of eyes, bringing it into the 21st century. Niles is a wonderful community. We've been part of the community, of course, that building. While Niles does have some different ethnic populations, so we were proud to take over as well our Russian program and our Korean program from the previous location, and we participate both in Niles and Chicago Korean community events, really. And we like to think of ourselves as kind of a service that hopefully people don't need, but if they do, that there's a really trusted name in the community, and we're very proud to do that. To address the second part of your question, the second location that used to be called Avanti Wellness and Rehab over on Tui near Grosse Pointe Road. And we actually have successfully purchased them, and they have changed their name now to Elevate Care North Branch as of 2 months ago. We have begun a renovation project there. We are putting in some new electrical wiring so that we can add some more medical equipment to the building. But we are proud to announce that as an addition to the Elevate Care family here in Niles.
Very exciting. So we know COVID has presented a unique set of challenges for all rehabilitation facilities. Can you share with us and how Elevate has handled that? And before we started today, you and I were talking about the fact that you're one of the first kind of frontline workers that we've had on here. So tell us what that's been like.
Certainly. Well, I can't take all the credit. I do not work directly with patients and residents as frequently as a lot of our staff. I mean, the nurses and the doctors that are working there day in and day out, I couldn't say enough good things. I couldn't congratulate and thank them enough for all their diligent hard work. Us, as well as our corporate staff. I mean, we put together at the beginning a COVID task force as part of our corporate staff. And it started out just, for example, we would have our daily 10:30 a.m. COVID phone call where all the buildings and all our corporate team gets together and talks. And, at the beginning, you think, okay, we'll do this 7 days a week and hopefully we'll get through this. But now here it is 9 months later, and you have these people that every single day, 7 days a week, we're getting together, we're going over our numbers, we're going over our changes, our policies. And it's really been an incredible amount of work, but really an incredible opportunity for all of our wonderful staff to step up and be in a position to contribute. At the beginning, it really took everybody off guard, as I think it did around the world.
Yeah, right? Yeah.
Nobody had seen anything like this. It was unprecedented. But as time went on, we worked very closely with the Illinois Department of Public Health, with the local CDC, and we were able to, over time, implement these guidelines. I'll give you one example. It used to be, hypothetically, you're in the hospital, you come to us because you broke your foot or whatever, and let's say you had a negative COVID test yesterday at the hospital. So it used to be you would come in and we'd say, okay, you have a negative COVID test from yesterday, you don't have COVID. But one of the changes that we made very early on, which proved to be, just a huge game changer for us, was we sat down and said, hey, there's a very real chance that you caught COVID last night, or you caught COVID in the lobby, or in the ambulance on the way over, or in the parking lot. And so every single person that comes in, we treat them as if they might have COVID. Again, even if they had a negative test yesterday. And that means we're putting them in isolation, we're wearing protective equipment, and we're treating everybody in that way for a period of time before we're sure. Additionally, we started testing every single person, that's staff and residents, every single week, so that if there was some sort of outbreak, we'd be able to identify it immediately. Something you and I were talking about just a few minutes ago, we actually, not because of what's going on in the building, but
excuse me.
But because what's going on in the community around us, we've upped that testing from once a week to twice a week, just to make sure to be extra careful. Thankfully, nobody has caught COVID in our buildings for quite a long time, although we do have a COVID recovery unit. So we are admitting people that have COVID. They're going directly onto our isolated unit. We've built walls. We've taken a lot of protective precautions, and thankfully we're doing a great job at stopping the spread. But it's very, very hard. And I would say from an emotional standpoint, the hardest thing that I've seen is families not being able to visit their family members. Really difficult. It's a hard time to have a family member in the hospital or in some sort of care environment and just not being able to speak with them. So one of the things we've done about that is we've bought several video tablets and iPads, and we've added dedicated activities staff that's the entire thing they do. They go from room to room with this iPad, and they do a video call with your loved ones, your son and daughter, your family members, so you can at least see them, talk to them, eat with them maybe while you're having a meal. And it's not ideal, but it's adapting with the times to figure out a way to do something.
Yeah. So what has been most challenging, the single most challenging thing during COVID?
I would say the stamina of our staff. Like I said at the beginning, it's okay, we all have to work as hard as we can for the time being, and we think it's going to be a few days and a few weeks and a few months. And
I was going to say, let's be honest, back in March we thought it was a few months, right? Tops.
Yeah. And now here we are, and people are worn out, but we have a great staff, and we can't even compare, unfortunately, to what the people in the hospitals are going through. I work very closely with the staff at many hospitals, and it's very difficult for them, and it's very difficult for our nursing staff. And I can't say enough good things about all the work that they do. One of the things I noticed early on was I remember very clearly one day was kind of slow. I didn't have as much work to do one day. Thankfully, a lot of people that I was working with in the hospital had gotten better or discharged. And I remember very distinctly the feeling of, today I had enough time to do all my work. There was enough hours in the day for me to do everything I needed to do today. And
What a good feeling.
yeah, what a change that was from having, and I sometimes would have 40, 50 people that I was keeping track of in one day, and for that number to go down to 15, really, you noticed
Huge.
it's
Yeah.
not enough time, and everybody's overwhelmed. And again, I can't say enough good things, and how thankful I am of the wonderful staff and committed team members that we have.
That's awesome. So you talked to us about this kind of new initiative of getting the iPads so that families can communicate with their loved ones. Are there any other new strategies that you put into place that you found, hey, this is something we're going to continue, COVID or not?
Well, certainly that, obviously, and who knows when visiting is ever going to become a thing again, unfortunately. Thankfully, maybe once vaccinations become more prevalent, that might open up again. But I would say first of all, we were able to streamline a lot of communication processes. I used to, for example, go physically to every hospital every day and go to the floors and talk to all the staff that I needed to speak with. But with just the overwhelming amount of work, I instituted, for example, with one hospital network, a morning phone call. 8 a.m., I have a phone call with the head of case management and the head of nursing, and I'm able to go over 10 patients on one phone call instead of having to physically go there. So just to be able to streamline, acknowledging the fact that we all have so much work to do, was able to kind of help us explore for ways to get our work done a little bit more efficiently. I'll add another new thing that the state of Illinois was very helpful with. Something you wouldn't necessarily know, but a lot of people have Medicare. Medicare is very popular. Anybody over 65, it's a government healthcare program. And the general rule is you can't just show up at our front door and say, I have Medicare, can you take care of me? You have to physically go to a hospital, spend a period of time in the hospital before Medicare will take over and cover. Thankfully, the state of Illinois said, we acknowledge that it's not realistic right now to have people in the hospital for a period of time just to meet that requirement. And they put out a directive and said, we'll waive that. It doesn't make sense to do that. You can show up at our door now and say that. So, for example, just today, I got a call from an emergency room. They said a gentleman had broken his foot, elderly gentleman had broken his foot. They would love to keep him at the hospital, but this particular hospital is at 95% capacity. Is there anything you can do? And the answer is yes, absolutely. And that was about 3 hours ago, actually, and he's already in our building. We were able to admit him.
That's fantastic.
So I think to answer your question of some of the changes that I think are going to help us going forward, even beyond this pandemic, are really the streamlining in communications, the additional efficiencies that we were able to identify, and making sure that there's no wasted time in the process. Let's say nobody has extra minutes to spend, so anything that can shave those minutes off was really helpful.
That's awesome. Ben, what's the best way for someone to contact your team? I've got a loved one in the hospital. I know we're going to have to go to skilled nursing. What's the best way for them to get in touch with you?
Absolutely. So first and foremost, we do have a website called elevatecare.com. And that's located on the bottom of the screen right now. But also, for anybody who's never been in this process before, there is a really important staff member in the hospital called a social worker. And social workers can do... do we have an extra minute for me to tell a story?
Yeah. Go ahead.
So a good friend of mine growing up, when he got married, his wife, this was well before I was in this industry, and his wife said, I'm a social worker in an emergency room. And I said, what does that mean? Why would an emergency room need a social worker? And she says, your house burned down. You're in an emergency room now. Where are you going to go? You need somebody to help you find services. Your family member died. You're in an emergency room right now. You don't know where to go. You need somebody there to really help you find services. And I said, okay, that makes sense. But now being in this industry, you realize really what an important role the social worker is. And their job is to help you discharge safely. And that could be Maybe you need oxygen now. Let's help you set up some oxygen delivery services at home. Maybe you need dialysis now. Let's help you set up a chair with a dialysis agency. Maybe you need skilled nursing. So the best answer I could give to your question is, if you or a family member are in that scenario in a hospital, somebody called a social worker will come and speak to you and talk to you about your options. And they're the person who you'd say, I'm aware of this place called Elevate Care. I'd love to get some more information about that. And that social worker will call me directly. Every social worker in Chicago has my phone number, or Niles has my phone number, and they'll call me directly, and I can guide you through the process. Whether you come to us or not, I can always help you understand your Medicare, your clinical needs, your financial needs. Again, helping guide people through this process is the most fulfilling part of the job for me, and it's really a very important service.
Excellent. So we're going to wrap up, and we'd like to end with a personal question. What is your favorite place to eat or right now carry out here in Niles?
Sure. Well, if I have a big appetite, there is a restaurant in Gulf Mill Mall called Ginza Sushi.
Okay.
It's a sushi and Asian food buffet, which I love. Of course, buffets unfortunately are a thing of the past, but for carry out, there is a small restaurant right next to us called Cece's Pizza. And if you ask them, they'll actually give you a pizza to go. You don't have to go in and eat the buffet. You can get a pizza to go.
There you go.
It's like under $9. You get the barbecue pork pizza is my favorite. And you just carry that out and take that with you wherever you're going. I would say that's my favorite.
Sounds great. Ben, thank you so much for taking the time to chat with us today.
Absolutely.
And we look forward to seeing you in person for a ribbon cutting soon.
Absolutely. We look forward to it. And thank you so much to the Niles Chamber of Commerce. We love to be part of the community, and we're not just a business that sits there on its own. The community, nobody exists in a vacuum. The community is a huge part of what we do, and we like to think of ourselves as providing a service to the local community, and we appreciate everything the Niles Chamber does.
Thank you, Ben. Have a great day.
Absolutely. You too.
Bye-bye.